welcome back to Betty. I'm your host, Cynthia Thompson, and do I have a treat for you today? Today you're going to learn so much about a special agency here in Charlotte that offers services to our blind and visually impaired citizens here. And the person that's going to share that with us is Dr. Hoffman. Thank you for joining me today.
Oh, thank you so much for having me.
You know, I have a ton of questions for you. So tell me, before we even get started with all of those, a little bit about you, who you are and what you do for the Metrolina Association for the Blind.
Well, as you said, my name is Dr. Lori Hoffman, and I am a low vision optometrist at Metrolina Association for the Blind, or as we call ourselves, MAB. I'm originally from Durham, North Carolina, and have recently relocated here to Charlotte about a year ago after being in Birmingham, Alabama for 9 years.
So the Metrolina Association for the Blind, that's a well-kept secret here. What exactly do you all do?
Well, we are a private nonprofit agency here in Charlotte, and basically we offer services for, like you said, those that are blind and visually impaired. And we have two divisions of our agency. One is called Accessible Braille Services, and one is our PAR, or Personal Adjustment Rehabilitation Services. And I work for the PAR part of our agency, and within that group we have low vision, we have vision rehab therapy, and then we also have orientation and mobility specialists.
And so the Braille services, what do you offer with them?
Yeah, that actually is the part of our agency that does Braille printing. We also do large print and then audio CDs for different companies such as, well, I don't know if I could say, but different companies in the Charlotte area and greater area, and they will do things such as billing statements and you know, prescription information and things like that. So if a blind person or a visually impaired person wanted to buy a book or a textbook, do you sell those to them or do you offer them for them? Yeah, we have different Braille materials that we can do, and we have our own Braille printing press, which is really cool too.
And so if a person needed your services, how would they even contact you?
Yes, our main agency is located on Louise Avenue, and we have people call all the time to ask about our services. Most of the referrals I get for low vision are actually from area ophthalmologists, mostly, you know, retina specialists or glaucoma specialists, you know, things like that. And then also some social workers from the different organizations with, you know, healthcare systems and things like that. And then we also have people that just come to us by self-referrals, so that's typically how it works.
So do you have a special section in your organization for children or adults, or is this all mixed together?
All mixed together. The youngest I have seen is age 5, all the way up to my oldest patient was 105. So we see all ages. If you have any type of visual impairment, we are happy to see you.
So you get your referrals from, you said it before, from doctors and social workers. Do you get them from anyone else, any other agencies? We
also do get, you know, referrals from local optometrists. Sometimes, you know, some of the neuro, you know, rehab facilities as well, and then, you know, just family members, friends, you know, and like I said, self-referrals as well. Some, you know, we do get some referrals from other agencies, like Division of Services for the Blind. Sometimes we work with them closely as well.
So do you provide this service for just people that live in Charlotte or the surrounding area?
Well, we mostly focus on our people that live in Charlotte. However, our low vision service, we actually have mobile clinics whereby we go to some of the other counties. Right now we service Union County, South Iredell, and Cabarrus County. So we can reach out to patients that maybe can't make it into Charlotte but really do need our services. So we do that once a month, and we rotate between the clinics.
You know, let's take a short break, and when we come back, I want to ask you some more questions about some of the services that you offer.
Sounds great. Yes.
Okay?
Lots of services. Yes.
All right.
Rosita, did you know there's a right way to sneeze? Let's show them, Elmo. Got it. When you feel like your nose needs to give it at you, this is how you act. This is what you do. Lift your arm up high, bend it toward your face. Sneeze right there in the bendy place. Achoo! Achoo! You can do it with ease. Achoo! Achoo! That's the right way to sneeze. Thank you. To
To learn more about preventing flu, visit flu.gov.
I'm home, and I love it. I'm home, where I belong.
It's always nice to come home, but many Americans are at risk of foreclosure and losing their homes. Making home affordable from the U.S. government has already helped over 1 million struggling homeowners like these. The sooner you act, the better chance we can help you.
I'm home, where I belong.
Questions?
What is your soup of the day?
Oh, how's that cooked?
Is it grilled?
Can I have it steamed?
So what do you recommend?
Any questions?
For the 10 questions everyone should know, go to ahrq.gov.
Tommy's a really good kid. My Tommy would never even think about trying alcohol. Isn't that right, sweetie?
Real kids are curious about alcohol. 40% try it by the 8th grade. Talk early, talk often, get others involved.
Coming home can be hard if you're a veteran of Iraq or Afghanistan. You may feel like you're all alone, but you're not alone. At iava.org, your fellow vets are all around you. Join our free online community, get the resources you need, and connect to other vets who know where you're coming from. iava.org. We've got your back.
Hi, welcome back to Betty. I'm your host, Cynthia Thompson. I'm here with Dr. Hoffman. We touched briefly on some of the things that the Metrolina Association for the Blind offers the citizens of Charlotte. And before we went on break, I said we're going to talk more in depth about the things that you do. Now, you've mentioned low vision quite a number of times. What exactly is that?
Low vision is basically where a person's vision cannot be corrected with glasses or contact lenses. So they have a permanent visual impairment in one or both eyes.
And so do you do a test to see if they have low vision, or do they just need glasses?
Typically, the patients that come to see me have a known visual impairment, and that's, like I said, the ones that come to us from other area doctors. And we don't offer per se vision screenings. That has already typically been done by the referring physician. So I work with people who are just mildly visually impaired all the way up to, legally blind. And then I don't work with, but we also, our other services work with patients that are totally blind, have no sight at all. So we really, service the whole spectrum of patients that have any type of visual impairment.
So this is kind of a trick question, don't get mad. What would you do for a person that's getting a little older and they're having to look at the paper like this to read it? Do you offer services for them, or do you refer them to their doctor? Yeah, we do have a kind of a policy so that those patients, we kind of identify them before they get to see me. Typically what happens is patients will be referred, and we have a social worker or case manager that will go do an initial intake, ask them questions, look over their eye report, because we do require a recent eye report, and so that's kind of how we figure out what level vision those patients have before they come and see me. You mentioned that you have a Braille service. Do you have any other special services, like for people that you have to use computers?
Yes.
You train them how to use their computers. What do you do with that? Yeah, we sure do. Our vision rehab therapist, that's our service that does handle computer training, teaching Braille, learning what we call just independent living skills, such as, learning how to cook for yourself, just be independent, any of those types of, money management or any type of skill that requires you to live independently, basically. Now, I know you can't do all this by yourself, and you've mentioned a few people that help you. I think you mentioned the case manager and social worker. Do you have an eye doctor on site? I'm the only eye doctor on site, yep. So I work with two CLVTs, which is certified low vision therapists, and then we have our orientation mobility specialists and our certified vision rehab therapists as well. So with all of these services that you offer, and it sounds like a lot, I'm sure you need extra help. So do you have volunteers that come in and help?
We do. Being a private nonprofit, obviously funding is always an issue because we get no state or federal funding. So we are always looking, for help in terms of volunteers. And what we tell people to do is to visit our website, which is www.mabnc.org. And we have great links, great information about our organization and our agency. And there is a link on there that will direct people who are interested in volunteering for us.
So what does it take to be a volunteer?
Really, it just depends on kind of what area you want to volunteer. If you're wanting to help, some of our clients who maybe need help in terms of just doing things in their home or something like that, or we're always looking for people to help, bring snacks and things like that for some of our events and our mini centers and support groups. And then also, we have people that can come in and if they want to volunteer on a long-term basis, do, as a receptionist position or those types of volunteer positions as well.
You said earlier that you were a nonprofit private organization. What exactly does that mean?
It means just, like I said, no state or federal funding. We are a United Way agency, so we do receive some funding from United Way, but the bulk of our funding is either just our own fundraising, and then that accessible Braille services that I had told you about earlier is actually our company that is the main source of funding for our nonprofits. So we're always trying to drum up business with them, different clients to help us, keep going in terms of funds. So,
let's take a short break, and when we come back, I want to ask you some more questions about the Braille services that you offer.
Yeah,
okay?
Definitely. Sounds great.
Any questions?
What kind of service plan does this come with?
Unlimited.
Can I keep my same phone number?
Absolutely.
How do I change the ringtone?
Just hook it up to your computer.
Does it have a camera? What's the warranty? Does it come in silver? Can I put my party shuffle on this? Does it have a 3.5 millimeter headset jack? You sell a lot of these?
It's the one I carry.
You ever get those phantom vibrations in your pocket?
Any questions?
No.
Are you sure?
Yeah.
Ask questions. For the 10 questions everyone should know, go to ahrq.com.
Hey.
Ready to go?
Yeah, but the fire's not out.
Close enough.
Close enough? If it's too hot to touch, it's too hot to leave. I mean, the next thing you know, you've torched our whole neighborhood.
Which is why we're not going anywhere?
Exactly. 9 out of 10 wildfires are caused by humans.
Only you can prevent wildfires.
Explore new worlds. Read. Visit literacy.gov and let the journey begin.
Hey, Luis, did you know that you're Elmo's plan?
Your plan?
Yeah, Elmo's mommy said that if Elmo is too sick to go to school, the plan is that Elmo stays with Luis and Maria.
Oh, yes, we have that plan all in place.
Great!
You never know when your child will be too sick to go to school. So have a plan ready so your child can stay home and get healthy.
Luis is the man, because he's Elmo's plan. The man, because he's Elmo's plan.
To learn more about preventing flu, visit flu.gov.
Hi, and welcome back to Better. I'm your host, Cynthia Thompson. I'm here with Dr. Hoffman. Now, Dr. Hoffman, before we went on break, I wanted to ask you about the Braille services that you offer. Now, I know Braille is the figures are raised on the paper. How do you do that? And
yeah, basically Braille is its own language, really, its own alphabet. And like I said, we have a Braille printing press, which is basically a Braille embosser, and it's a series of raised dots in a certain order that create any type of wording or numbering that you could ever dream of. So it's just, like I said, a language. And so a lot of our patients that are, like I said, totally blind or are severely impaired to where they don't have much useful vision left, a lot of them will take up Braille just as a means of communication, a way to read and, just be independent.
You know, I want to share with you a story, and the reason why I have you on my show today is because I have a dear friend that I work with. She had this really freak accident. She was exercising, doing pull-ups, and the hook on the bar snapped and it fell right between her eyes, and it did a lot of damage to her eyes, and you all helped her to be able to come back to work. Is that something that anyone could come, if by chance they have a freak accident, can come and get help from you, from your service?
We see patients all the time that have had a sudden loss of vision for different, whether it's disease or trauma or anything like that. And our goal is to help patients be independent, and that includes work. So we do, we work closely with Division of Services for the Blind and vocational rehab in terms of getting people back into the workplace, because really just because you have a visual impairment or are blind, you can do anything you want to do. And so we have lots of clients and patients that are able to go back to work after seeing us and receiving devices and training to be able to do that.
Do you provide glasses for folks that need them, or do they need to go to their regular doctor?
Yeah, I do. When I see patients, I do check patients for glasses, and we don't have an optical or an optician on site, but I do give patients the prescription, and they're free to take it wherever they want.
You know, we have only a few minutes left. Would you like to share with us a special story about someone that you helped that came into your office?
Well, all my patients, this is just such a wonderful, fulfilling job, and I feel so blessed to have been given this opportunity. Really, my favorite patients, and I've been getting a lot of them recently, are my kids. I guess just because school started and everyone is coming in, but I really enjoy working with my kids. I had one sweet girl, and she recently she had an inherited disorder that has caused her to lose her vision, and she now finds herself legally blind. She's in elementary school, so she's that's tough to have to deal with, and so it was just so wonderful seeing her, and after showing her the devices, the magnifiers, the different devices that we have, training and showing them to her, it was just amazing and priceless to see her face, to know that she didn't have to be different, and that she could see to read and watch TV just like all of her friends. And so just stories like that really just make me just so happy to be doing what I'm doing.
Since you brought that up, that brought up another question. Do you offer any counseling for people? Like my friend that had the trauma to her eyes. All of a sudden she's having a vision problem, or someone that's just suddenly became blind. Do you offer counseling for people that go through those situations too?
Yeah, we have kind of a limited counseling. It just depends. A lot of our social workers can do kind of grief counseling and stuff like that on a limited basis, but we do have wonderful resources to where we can refer out if it needs to be more of a long-term counseling. But we also do have something called Mini Center and Support Group, and that is a really cool program that we have where one of our former social workers, who is actually totally blind from birth.
Oh, really?
She leads a support group. So it's a group of our clients. It's a small group, and she leads just weekly talks and discussions, and it's a support group. So talking with other people that are dealing with the same issues you are. So that has been a real success, for our agency offering that.
This is really my last question, because I keep coming up with more and more and more. Why did you decide to go into this field of work?
Yeah, going through optometry school, I've always loved the eyes, and I've always been interested in the eyes, and I myself have pretty poor vision, but I wear contacts, and so it's fine. But I always had such great experiences growing up with my eye doctor, and so I knew I wanted to be an eye doctor. And then in school, I just kind of found my niche in low vision rehabilitation, and just helping people, there's such satisfaction, and it's just such a wonderful experience to be able to help people see and to read again, and just things that they thought they never would be able to do again because they've lost their sight, to show them ways to be able to do that. It's just, I knew that this is what I wanted to do.
And before we close again, your website is?
It's www.mabnc.org.
And your phone number?
Yeah, you can call us at 372, oh wait, no. 704-887-5100. We have so many numbers, but that's it. Hopefully you can edit that out.
And your and your address, where you're located.
Yeah, our main office is 704 Louise Avenue here in Charlotte, 28204.
And again, if someone needs your assistance, they can
come by our main office or call us at 704-887-5100.
Or their doctor can refer them, or a social worker.
Exactly. Yep.
Thank you so much for joining me
thank
today.
You so much for having me,
I've
Cynthia.
learned a lot about the services that you offer.
Well, I hope people will know about us now and take advantage of the wonderful services we have to offer.
I want to thank each and every one of you for joining us here to Better You, here on Public Access every Wednesday night at 6 p.m. Thank you so much again.
Thank you so much, Cynthia. Appreciate it.